Phlebotomy Certification Exam Full Review 2026. Question 1. What is the maximum depth that a lancet should penetrate when performing a heel stick puncture on a newborn infant? Option F 1.0 mm, Option B 2.0 mm, Option C 3.0 mm, Option D 4.0 mm. The correct answer is option B, 2.0 mm. A newborn heel lancet should not penetrate deeper than 2.0 mm. This limit reduces the risk of striking bone and causing osteomyelitis. Deeper punctures are unsafe even if blood flow is difficult. Question 2. What does the term leukemia describe? Option A high concentration of broken red blood cells giving serum a red tint. Option B, a milky or cloudy appearance of serum or plasma caused by high lipid or fat content. Option C, a dark yellow or amber tint in serum caused by elevated bilirubin levels. Option D, a clear, watery fluid component lacking any cellular proteins. The correct answer is option B, a milky or cloudy appearance of serum or plasma caused by high lipid or fat content. Leukemia describes a cloudy or milky serum or plasma appearance caused by high lipid content. It commonly follows recent fatty meals or certain metabolic conditions. Hemolysis appears red or pink, while icterus appears yellow to amber. Question 3. What should the phlebotomist do immediately before applying a bandage to a venipuncture site? Option A, check the site to confirm that active bleeding has completely stopped. Option B, ask the patient to bend their elbow firmly over the gauze pad. Option C, apply a generous layer of antibiotic ointment to the wound. Option D, label the tubes using the patient's bedside charts. The correct answer is option A, check the site to confirm that active bleeding has completely stopped. The puncture site must be checked to confirm bleeding has stopped before a bandage is applied. Bandaging over active bleeding can hide continued blood loss and increase bruising. Bending the elbow can also promote hematoma formation and should not be used as pressure technique. Question 4. What is the primary function of the anticoagulant EDTA? Option A, it enhances the action of thrombin. Option B, it binds calcium ions, preventing the clotting cascade from activating. Option C, it destroys white blood cells to preserve red cells. Option D, it stabilizes glucose levels by stopping cellular glycolysis. The correct answer is option B, it binds calcium ions, preventing the clotting cascade from activating. EDTA binds calcium ions and prevents the coagulation cascade from progressing. This preserves whole blood for hematology testing and maintains cell morphology. It does not preserve glucose or accelerate clotting. Question 5. What should a phlebotomist do when a multisample vacuum tube fails to fill with blood during a draw? Option A, gently advance or pull back the needle slightly to ensure it is in the lumen. Option B, remove the needle completely and start over on the other arm. Option C, leave the tube in place for 3 minutes to allow the vacuum to recover. Option D, push the needle deeper at a 90-degree angle. The correct answer is option A, gently advance or pull back the needle slightly to ensure it is in the lumen. A vacuum tube that fails to fill may indicate the needle bevel is against the vein wall or not fully in the lumen. A small adjustment forward or backward can restore flow without unnecessary reinsertion. Pushing deeply or waiting for the vacuum to recover can injure tissue and waste time. Question 6. Which of the following scenarios is considered a breach of the Health Insurance Portability and Accountability Act? HIPAA. Option A, discussing a patient's laboratory results with the ordering physician. Option B, discussing a patient's lab results with a colleague in the hospital cafeteria. Option C, entering patient information into an encrypted laboratory information system. Option D, sharing critical panic values with the nurse assigned to the patient. The correct answer is option B, discussing a patient's lab results with a colleague in the hospital cafeteria. Discussing patient results in a public cafeteria exposes protected health information to unauthorized listeners. HIPAA permits sharing information for treatment with authorized team members, but only in appropriate settings. Casual conversations in public areas violate confidentiality even when the colleague works in healthcare. Question 7. What occurs during the pre-analytical phase of laboratory operations? Option of running standard controls on a chemistry profile machine. Option B, all processes involved in patient identification, collection, handling, and transport prior to actual sample analysis. Option C, interpreting a bone marrow biopsy under a microscope. Option D, transmitting final electronic medical record entries to billing. The correct answer is option B, all processes involved in patient identification, collection, handling, and transport prior to actual sample analysis. The pre-analytical phase includes everything that happens before actual testing, including orders, patient identification, collection, handling, and transport. Many laboratory errors occur in this phase because specimen quality is established before analysis begins. Analyzer operation and result reporting belong to later phases. Question 8. What is the appropriate antiseptic choice for blood culture site preparation in patients older than 2 months? Option A, 70% isopropyl alcohol alone. Option B, chlorhexidine gluconate or tincture of iodine. Option C, sterile saline solution. Option D, benzalkonium chloride. The correct answer is option B, chlorhexidine gluconate or tincture of iodine. Blood culture site preparation must strongly reduce skin flora to prevent false positive cultures. Chlorhexidine gluconate or tincture of iodine is commonly used for patients older than 2 months, depending on policy. Alcohol alone is not sufficient for many culture protocols, and saline is not an antiseptic. Question 9. Which of the following standard precautions applies to the disposal of used venipuncture needles? Option of recapping the needle before throwing it away. Option B, placing the needle in a biohazard bag. Option C, activating the safety device and placing it in a sharps container. Option D, dropping the needle into a regular waste bin if no blood is visible. The correct answer is option C, activating the safety device and placing it in a sharps container. Used needles must be made safe immediately and placed into an approved sharps container at the point of use. Recapping, carrying loose needles, or placing them in bags creates preventable needle stick risk. Visible blood is not required for an item to be treated as contaminated after use. Question 10. Which of the following options defines the proper site for performing a venipuncture on a patient's hand? Option A, the ventral aspect of the wrist near the radial artery. Option B, the dorsal aspect of the hand, focusing on the dorsal venous network. Option C, the inside aspect of the thumb pathway. Option D, the lateral borders of the palm. The correct answer is option B, the dorsal aspect of the hand, focusing on the dorsal venous network. Hand venipuncture is performed on the dorsal venous network on the back of the hand. These veins are superficial and require careful anchoring and a shallow angle. The palm, wrist, or underside of the hand carries more risk and is not preferred. Question 11. When performing a dermal puncture on an infant's heel, what is the maximum allowable depth to prevent osteomyelitis? Option F, 1.0 mm. Option B, 2.0 mm. Option C, 3.0 mm. Option D, 4.0 mm. The correct answer is option B, 2.0 mm. Newborn heel punctures must be shallow enough to avoid the calcaneus and deeper tissues. A maximum depth of 2.0 mm is used to reduce the risk of osteomyelitis and nerve or bone injury. Deeper lancets are unsafe for infants even if they appear to improve blood flow. Question 12. Which of the following options describes a pre-analytical error that can occur in phlebotomy? Option A, miscalibrating an automated glucose analyzer machine. Option B, misidentifying a patient or mislabeling a specimen collection tube at the bedside. Option C, delaying the entry of finalized lab results into the electronic medical record. Option D, misinterpreting a cellular structure under a microscope. The correct answer is option B, misidentifying a patient or mislabeling a specimen collection tube at the bedside. Misidentifying a patient or mislabeling a tube occurs before the sample is analyzed, making it a pre-analytical error. These errors are especially dangerous because the laboratory may produce a technically valid result on the wrong specimen. Analyzer calibration and final reporting occur in later phases. Question 13. Which of the following errors is an example of a post-analytical error? Option A, failing to mix an EDTA tube, causing a microclot to form. Option B, mislabeling a patient's name at the bedside drawer. Option C, delayed reporting of critical panic values to the attending physician. Option D, leaving a tourniquet on a patient's arm for 3 minutes. The correct answer is option C, delayed reporting of critical panic values to the attending physician. Delayed reporting of a critical value occurs after analysis, so it is a post-analytical error. Timely communication of panic values is essential because treatment may depend on rapid notification. Collection, labeling, and tube mixing errors occur before analysis. Question 14. When using a butterfly wind infusion set with a light blue top tube, why must a discard tube be drawn first? Option A, to clear any residual skin surface contaminants from the needle. Option B, to purge the air out of the butterfly tubing to ensure a proper fill volume. Option C, to activate the coagulation cascade prior to sample collection. Option D, to check if the vein has adequate pressure to fill a full tube. The correct answer is option B, to purge the air out of the butterfly tubing to ensure a proper fill volume. Butterfly tubing contains air that can reduce the fill volume of the first tube collected. A discard tube removes that air so a light blue citrate tube fills to the required level. The discard is not collected to clean the needle or activate clotting. Question 15. What is the proper clinical intervention if a hematoma forms rapidly under the skin while you are drawing a patient's blood? Option A, press down hard on the needle to flatten out the swelling. Option B, release the tourniquet immediately, pull the needle out, and apply firm pressure to the site. Option C, switch to a larger vacuum tube to pull the pooled blood out of the tissue. Option D, continue the draw until all ordered tubes are filled completely. The correct answer is option B, release the tourniquet immediately, pull the needle out, and apply firm pressure to the site. Rapid hematoma formation means blood is escaping into tissue during the draw. The tourniquet should be released, the needle removed, and firm pressure applied to stop the bleeding. Continuing the collection or trying to drain the swelling through the tube can worsen injury. Question 16. What is the maximum amount of time a tourniquet should remain tied on a patient's arm during a venipuncture? Option A, 30 seconds. Option B, 1 minute. Option C, 2 minutes. Option D, 3 minutes. The correct answer is option B, 1 minute. Tourniquet time should generally be limited to 1 minute to prevent venous stasis and hemoconcentration. Longer application can concentrate proteins, cells, potassium, calcium, and other analytes. Releasing and reapplying after a pause is safer than leaving it tied while searching for a vein. Question 17. Which of the following statements matches the correct definition of assault? Option A, unjustified or unconsented physical contact with another person. Option B, the intentional threat or attempt to cause bodily harm, creating fear in the patient. Option C, revealing confidential medical findings to unauthorized personnel. Option D, mislabeling a laboratory specimen tube by accident. The correct answer is option B, the intentional threat or attempt to cause bodily harm, creating fear in the patient. Assault is an intentional threat or attempt that makes a patient fear harmful contact. No physical touching is required for assault to occur. Battery involves unauthorized touching, and confidentiality breaches involve private information rather than threatened harm. Question 18. Which of the following is a characteristic of arterial punctures that differentiates them from venipunctures? Option A, the blood is typically dark red or maroon. Option B, the blood will pulse spontaneously into the syringe. Option C, a tourniquet must be applied extremely tight. Option D, the angle of needle insertion is 15 degrees. The correct answer is option B, the blood will pulse spontaneously into the syringe. Arterial blood is under higher pressure and may pulse into the syringe without vacuum assistance. It is usually brighter red because it is more oxygenated. Venous blood typically flows more steadily and is collected at a shallower angle. Question 19. What color top tube contains sodium heparin or lithium heparin and is the primary choice for stat chemistry determinations? Option A, green top. Option B, light blue top. Option C, lavender top. Option D, yellow top. The correct answer is option A, green top. Green top tubes contain sodium or lithium heparin and are commonly used for stat chemistry testing. Heparin allows plasma to be separated quickly without waiting for clot formation. Serum tubes require clotting time and are not always ideal for urgent chemistry turnaround. Question 20. What type of vessel links the smallest arterial pathways with the smallest venule pathways? Option A, capillary. Option B, sinusoid. Option C, lymph duct. Option D, deep artery. The correct answer is option A, capillary. Capillaries connect arterioles and venules and provide the main exchange surface between blood and tissues. Their thin walls allow movement of gases, nutrients, and wastes. Arteries and lymph ducts perform different transport functions. Question 21. What is the function of the systemic circulatory system? Option A, moving blood exclusively between the heart and the lungs for gas exchange. Option B, routing oxygenated blood and nutrients from the heart out to the rest of the body tissue networks. Option C, filtering liquid waste products through the nephron beds of the kidneys. Option D, producing white blood cells within the flat bones of the axial skeleton. The correct answer is option B, routing oxygenated blood and nutrients from the heart out to the rest of the body tissue networks. Systemic circulation delivers oxygenated blood and nutrients from the left side of the heart to body tissues. It also returns deoxygenated blood and metabolic waste products back toward the right side of the heart. Pulmonary circulation is limited to blood flow between the heart and lungs. Question 22. Which of the following tests requires a 24-hour urine collection? Option A, culture and sensitivity, C and S. Option B, creatinine clearance. Option C, routine chemical urinalysis. Option D, pregnancy HCG confirmation. The correct answer is option B, creatinine clearance. Creatinine clearance testing often requires a 24-hour urine collection to measure renal clearance over time. The timed urine result is usually paired with a blood creatinine level. Routine urinalysis, pregnancy testing, and cultures use different urine collection methods. Question 23. Which of the following tests must be kept warm at body temperature during transport to the laboratory? Option A, cryoglobulins. Option B, ammonia. Option C, lactic acid. Option D, free fatty acids. The correct answer is option A, cryoglobulins. Cryoglobulin specimens must be maintained at body temperature until processing because the proteins can precipitate when cooled. Warming prevents premature precipitation that can alter test results. Ice transport is used for analytes such as ammonia or lactic acid, not cryoglobulins. Question 24. What is the clinical term for a localized infection or inflammation of the bone caused by accidental needle striking during a heel stick? Option A, osteosarcoma. Option B, osteomyelitis. Option C, osteoarthritis. Option D, osteopenia. The correct answer is option B, osteomyelitis. Osteomyelitis is infection or inflammation of bone. In heel puncture, it can occur if the lancet penetrates too deeply and injures the calcaneus. Proper site choice and maximum depth limits are used to prevent this serious complication. Question 25. Which of the following tests requires that the sample be protected from light by wrapping the tube in aluminum foil? Option A, vitamin B12 and carrot. Option B, blood urea nitrogen, BUN. Option C, partial thromboplastin, PTT. Option D, complete blood count, CBC. The correct answer is option A, vitamin B12 and carrot. Vitamin B12 and carrot are light sensitive and may require protection with foil or an amber container. Light exposure can degrade sensitive analytes and produce inaccurate results. BUN, PTT, and CBC do not have the same routine light protection requirement. Question 26. Which department of the laboratory processes a comprehensive metabolic panel, CMP? Option A, hematology. Option B, microbiology. Option C, clinical chemistry. Option D, blood bank. The correct answer is option C, clinical chemistry. A comprehensive metabolic panel measures chemistry analytes such as electrolytes, glucose, kidney markers, proteins, and liver-associated enzymes. These tests are processed in clinical chemistry, hematology, microbiology, and blood bank perform different categories of testing. Question 27. Which of the following situations can lead to a charge of negligence against a phlebotomist? Option A. Forgetting to sign your initials on a laboratory requisition sheet. Option B. Leaving a tourniquet tied on a patient's arm for 5 minutes, resulting in permanent nerve injury. Option C. Experiencing a minor specimen rejection due to an underfilled tube. Option D. Utilizing a butterfly needle on an elderly patient's hand vein. The correct answer is option B. Leaving a tourniquet tied on a patient's arm for 5 minutes, resulting in permanent nerve injury. Negligence occurs when a healthcare worker fails to meet the expected standard of care and the patient is harmed. Leaving a tourniquet on for 5 minutes can cause avoidable injury and inaccurate results. A poor outcome alone is not negligence unless duty, breach, harm, and causation are present. Question 28. What type of specimen is obtained when a blood sample collected in a heparinized tube is centrifuged? Option A. Serum. Option B. Plasma. Option C. Whole blood. Option D. Fibrin clot. The correct answer is option B. Plasma. Centrifuged blood collected in a heparin tube yields plasma because clotting was prevented. Plasma contains fibrinogen and other clotting factors. Serum requires the blood to clot before centrifugation. Question 29. What is the primary medical reason for avoiding dermal punctures on the heel of an infant who has begun walking? Option A. The skin has developed calluses that block capillary action flow. Option B. The child's heel bone is too small to locate accurately. Option C. Walking stimulates tissue changes and calluses, and the puncture can cause deep tissue or nerve irritation. Option D. Walking diverts all white blood cells up toward the abdominal cavity. The correct answer is option C. Walking stimulates tissue changes and calluses, and the puncture can cause deep tissue or nerve irritation. Once an infant begins walking, heel tissue becomes thicker and more calloused and is more vulnerable to deep tissue irritation. Heel puncture at that stage can be painful and less reliable for capillary sampling. Finger puncture or another approved method is used according to age and policy. Question 30. What is the function of the thixotropic gel inside a plasma separator tube, PSD? Option A. To accelerate the activation of the coagulation cascade. Option B. To form a physical separation barrier between the cells and the plasma layer during centrifugation. Option C. To preserve the concentration of glucose molecules for 24 hours. Option D. To bind heavy metals and trace elements within the sample. The correct answer is option B. To form a physical separation barrier between the cells and the plasma layer during centrifugation. The gel in a plasma separator tube forms a physical barrier between plasma and cells during centrifugation. This reduces ongoing cellular metabolism and analyte exchange after separation. The anticoagulant in the tube is lithium heparin, not the gel itself. Question 31. Which of the following procedures describes the correct method for transporting an ammonia specimen to the laboratory? Option A. Keep the tube warm inside an incubator at 37 degrees Celsius. Option B. Place the tube immediately into an ice and water slurry to chill it completely. Option C. Wrap the tube tightly in heavy foil to prevent any exposure to room lights. Option D. Maintain the tube at a room temperature of exactly 25 degrees Celsius. The correct answer is option B. Place the tube immediately into an ice and water slurry to chill it completely. Ammonia specimens must be chilled promptly in an ice and water slurry and transported quickly. Delayed or warm handling can allow ammonia levels to rise in the specimen. Light protection and warm incubation are used for different tests. Question 32. What is the clinical term for an increase in the total number of circulating red blood cells? Option A. Anemia. Option B. Polycythemia. Option C. Leukemia. Option D. Thrombocytopenia. The correct answer is option B. Polycythemia. Polycythemia means an increased total number of circulating red blood cells or increased red cell mass. It can thicken blood and increase thrombotic risk depending on cause. Anemia is decreased red cell or hemoglobin concentration. Question 33. Which of the following parameters is most heavily impacted if a phlebotomist squeezes or milks a finger during a capillary puncture? Option A. The sample will be contaminated with tissue fluids, leading to inaccurate results or hemolysis. Option B. The blood flow will stop completely due to arterial vasoconstriction. Option C. The platelet count will become falsely elevated beyond high limits. Option D. The glucose values will drop to zero within seconds. The correct answer is option A. The sample will be contaminated with tissue fluids, leading to inaccurate results or hemolysis. Milking a finger forces tissue fluid into the drop and can rupture cells. This dilutes the specimen and may cause hemolysis or inaccurate results. Gentle warming and proper puncture technique are preferred ways to improve blood flow. Question 34. What should a phlebotomist do if an inpatient's door is closed and a sign states "No visitors, see nurse" before entering? Option A. Knock loudly, open the door, and walk right in to maintain efficiency. Option B. Locate the nurse assigned to the patient to find out the specific isolation or safety entry protocols. Option C. Skip the patient and come back at the end of the shift without checking in. Option D. Call the patient's room phone from the hallway to ask if it is okay to enter. The correct answer is option B. Locate the nurse assigned to the patient to find out the specific isolation or safety entry protocols. Assign directing staff to see the nurse may indicate isolation, safety, behavioral, or procedure restrictions. The phlebotomist should check with the assigned nurse before entering. Entering without clarification can endanger the patient, staff, or specimen collection process. Question 35. What is the maximum acceptable delay time for separating serum or plasma from cells for most routine chemistry tests? Option A. 30 minutes. Option B. 2 hours. Option C. 4 hours. Option D. 8 hours. The correct answer is option B. 2 hours. For many routine chemistry tests, serum or plasma should be separated from cells within about 2 hours. Delayed separation allows cells to consume glucose and release or exchange analytes. Excessive delay can produce inaccurate results even if the collection itself was successful. Question 36. What should a phlebotomist do immediately after activating the safety device on a used venipuncture needle? Option A. Place the needle assembly into a rigid, leak-proof sharps container located near the point of use. Option B. Drop the needle into a biohazard waste bag with blood-stained gauze. Option C. Set the needle down on the patient's bedside table until the tubes are fully labeled. Option D. Detach the needle from the tube holder adapter and place only the needle into the sharps container. The correct answer is option A. Place the needle assembly into a rigid, leak-proof sharps container located near the point of use. After the safety device is activated, the used needle assembly should go directly into a rigid, leak-proof sharps container near the point of use. Immediate disposal minimizes handling and needle stick risk. Needles should not be recapped, carried around, or placed in regular trash. Question 37. What is the proper angle of insertion when using a winged infusion set, butterfly needle, to draw from a hand vein? Option A. 5 to 10 degrees. Option B. 10 to 15 degrees. Option C. 30 to 45 degrees. Option D. 60 to 90 degrees. The correct answer is option B. 10 to 15 degrees. A butterfly needle is inserted at a lower angle, often about 10 to 15 degrees, especially for superficial hand veins. The shallow angle helps enter small veins without puncturing through them. Steeper angles are more likely to cause infiltration or injury in hand veins. Question 38. Which of the following items is the preferred antiseptic for cleaning a site prior to performing an arterial blood gas (ABG) draw? Option A. 70% isopropyl alcohol followed by chlorhexidine gluconate or povidone iodine. Option B. Plain sterile water. Option C. Diluted hydrogen peroxide solution. Option D. Sodium hypochlorite spray. The correct answer is option A. 70% isopropyl alcohol followed by chlorhexidine gluconate or povidone iodine. Arterial puncture sites require strong antisepsis because the procedure is deeper and carries higher complication risk than routine venipuncture. Alcohol followed by chlorhexidine or povidone is commonly used according to policy. Sterile water, peroxide, or bleach sprays are not appropriate skin antiseptics for ABG collection. Question 39. What should a phlebotomist do if they note that a light blue top tube did not fill completely due to a loss of vacuum during a draw? Option A. Use the partial sample anyway and send it to the lab. Option B. Discard the partial tube and draw a fresh light blue tube to ensure the correct 9:1 blood to additive ratio. Option C. Pour blood from a green top tube into the light blue tube to top it off. Option D. Shake the tube vigorously to force the remaining air out. The correct answer is option B. Discard the partial tube and draw a fresh light blue tube to ensure the correct 9:1 blood to additive ratio. An underfilled light blue tube must be discarded and recollected because the 9:1 blood to citrate ratio is no longer valid. Sending the partial tube may produce falsely prolonged coagulation results. Transferring blood between tubes or shaking the tube cannot restore the required ratio. Question 40. Which of the following conditions is an example of an autoimmune or hematological test commonly drawn in a lavender tube? Option A. Prothrombin time, patient. Option B. Erythrocyte sedimentation rate, ESR. Option C. Basic metabolic panel, BMP. Option D. Blood culture series. The correct answer is option B. Erythrocyte sedimentation rate, ESR. ESR is commonly collected in an EDTA tube because the test evaluates red cell settling in anticoagulated blood. Lavender tubes preserve cellular components and prevent clotting. Coagulation and chemistry tests require different tubes and additives. Question 41. Which of the following parameters can cause a false elevation in a patient's white blood cell count? Option A. Collecting the sample while the patient is crying intensely or under extreme stress. Option B. Chilling the specimen on an ice slurry before transport. Option C. Protecting the collection tube from direct artificial room lights. Option D. Allowing the serum to sit on the cells for more than 2 hours. The correct answer is option A. Collecting the sample while the patient is crying intensely or under extreme stress. Extreme stress, crying, or intense physical exertion can temporarily elevate the white blood cell count. Stress hormones can shift leukocytes into circulation and make the value appear higher. Specimen chilling or light protection does not produce this physiologic leukocytosis. Question 42. Which of the following veins runs along the lateral, outer, aspect of the antecubital fossa and is considered the second choice for venipuncture? Option A. Basilic vein. Option B. Cephalic vein. Option C. Median cubital vein. Option D. Axillary vein. The correct answer is option B. Cephalic vein. The cephalic vein runs along the lateral, thumb side aspect of the antecubital area. It is often considered after the median cubital vein because it may be less anchored or harder to access. The basilic vein is medial and closer to major nerves and arteries. Question 43. What type of fire hazard is represented by the red quadrant of the NFPA 704 diamond? Option A. Flammability hazard. Option B. Health hazard. Option C. Reactivity hazard. Option D. Specific hazard. The correct answer is option A. Flammability hazard. The red quadrant of the NFPA 704 diamond indicates flammability hazard. It communicates how readily a material can ignite. Blue represents health, yellow represents instability, and white indicates special hazard information. Question 44. What type of collection is performed to screen for hidden blood in a stool specimen? Option A. Occult blood test, GUARC. Option B. Culture and sensitivity, C&S. Option C. Dover and parasites, ONP. Option D. Fecal fat quantification. The correct answer is option A. Occult blood test, GUARC. An occult blood test, often using a GUARC method, screens stool for hidden blood. It can help detect gastrointestinal bleeding that is not visible. Culture, over and parasite testing, and fecal fat analysis evaluate different stool conditions. Question 45. Which of the following actions represents the correct method for mixing an additive collection tube after drawing? Option A, shaking the tube vigorously up and down 10 times. Option B, inverting the tube gently back and forth the recommended number of times, typically 3 to 10 depending on tube type, to ensure adequate mixing without causing hemolysis. Option C, letting the tube sit completely undisturbed in a vertical rack to mix over time. Option D, rolling the tube vigorously between your palms for 2 minutes. The correct answer is option B, inverting the tube gently back and forth the recommended number of times, typically 3 to 10 depending on tube type, to ensure adequate mixing without causing hemolysis. Additive tubes must be mixed by gentle inversion for the number of times recommended for that tube type. This distributes the additive evenly without causing hemolysis. Vigorous shaking or inadequate mixing can create clots, cell damage, or inaccurate results. Question 46. Which of the following procedures requires a strict chain of custody documentation form to accompany the sample? Option A, routine cholesterol screen. Option B, workplace drug testing. Option C, blood culture for endocarditis. Option D, complete blood count for anemia. The correct answer is option B, workplace drug testing. Workplace drug testing requires chain of custody documentation because results may have legal or employment consequences. The form tracks the specimen from collection through analysis and reporting. Routine cholesterol, CBC, or culture specimens do not usually require forensic level tracking. Question 47. Which of the following tubes contains an additive that preserves cellular morphology for a differential blood smear? Option of light blue top. Option B, lavender top, EDTA. Option C, gray top. Option D, green top. The correct answer is option B, lavender top, EDTA. Lavender EDTA tubes preserve cellular morphology for differential counts and blood smears. EDTA prevents clotting without causing major distortion of white blood cell appearance when smears are prepared promptly. Citrate, fluoride, and heparin tubes are not preferred for routine differential morphology. Question 48. What type of vessel carries oxygenated blood away from the heart to the systemic tissues? Option A, artery. Option B, vein. Option C, capillary. Option D, venule. The correct answer is option A, artery. Systemic arteries carry oxygenated blood away from the heart to body tissues. They operate under higher pressure and have thicker walls than veins. The pulmonary artery is an exception because it carries deoxygenated blood to the lungs. Question 49. What color top tube contains the additive sodium citrate and is used for coagulation profiles? Option of light blue top. Option B, lavender top. Option C, green top. Option D, gray top. The correct answer is option A, light blue top. Light blue tubes contain sodium citrate and are used for coagulation profiles. Citrate binds calcium reversibly and preserves clotting factors for testing when the tube is properly filled. Other tube colors contain additives that can interfere with coagulation assays. Question 50. What type of isolation room requires the air pressure to be lower than the surrounding hallway air pressure? Option A, negative pressure isolation room, airborne precautions. Option B, positive pressure isolation room, protective isolation. Option C, standard contact isolation room. Option D, droplet precaution room. The correct answer is option A, negative pressure isolation room, airborne precautions. Airborne isolation uses negative room pressure so contaminated air flows into the room rather than out to the hallway. This helps contain airborne pathogens such as tuberculosis, measles, or varicella. Protective isolation for immunocompromised patients often uses positive pressure instead. Question 51. What type of vessel contains thick, muscular walls and carries blood away from the heart under high pressure? Option A, vein. Option B, artery. Option C, capillary. Option D, venule. The correct answer is option B, artery. Arteries have thick, muscular, elastic walls that carry blood away from the heart under pressure. This structure allows them to tolerate pulsatile pressure generated by ventricular contraction. Veins return blood at lower pressure and often contain valves. Question 52. Which additive is present in a light blue top tube used for coagulation testing? Option A, sodium heparin. Option B, ethylenediamine tetracetic acid, EDTA. Option C, sodium citrate. Option D, potassium oxalate. The correct answer is option C, sodium citrate. Sodium citrate prevents clotting by binding calcium while preserving coagulation factors for testing. The tube must be filled properly because the citrate-to-blood ratio directly affects clotting test accuracy. EDTA, heparin, and oxalate tubes use different anticoagulant mechanisms and are not substitutes for routine coagulation studies. Question 53. Which of the following additives is found in a green top tube and works by inhibiting the action of thrombin in the clotting process? Option A, sodium citrate. Option B, EDTA. Option C, heparin, lithium, ammonium, or sodium. Option D, potassium oxalate. The correct answer is option C, heparin, lithium, ammonium, or sodium. Green top tubes contain heparin, which prevents clotting by enhancing antithrombin activity and inhibiting thrombin. Lithium, sodium, and ammonium heparin are selected based on test requirements. Citrate, EDTA, and oxalate prevent clotting by binding or precipitating calcium. Question 54. Which of the following items is classified as a biohazard and must be disposed of in a rigid sharps container? Option A clean, unused plastic tube holder. Option B, a blood-soaked gauze pad. Option C, a used lancet device from a heel stick. Option D, the paper backing from an adhesive bandage. The correct answer is option C, a used lancet device from a heel stick. A used lancet is a contaminated sharp and must be placed in a rigid sharps container. Sharps disposal prevents puncture injury and blood-borne pathogen exposure. Gauze may be biohazardous if saturated, but it does not belong in a sharps container unless it contains a sharp. Question 55. Which analytical error is categorized as a pre-examination, pre-analytical error? Option A, miscalibrating a chemistry analyzer machine. Option B, misidentifying a patient before collecting their sample. Option C, misinterpreting a reading on a microscopic smear sheet. Option D, delays in transmitting finalized electronic reports to the doctor. The correct answer is option B, misidentifying a patient before collecting their sample. Misidentifying a patient before collection is a pre-examination error because it occurs before the specimen is analyzed. Pre-analytical errors often have the greatest impact on patient safety because the wrong sample can produce a believable but unsafe result. Analyzer calibration and report transmission belong to later phases. Question 56. Which of the following additives is found in a yellow top tube used for human leukocyte antigen, HLA, typing or DNA studies? Option A, sodium polyant whole sulfonate, SPS. Option B, acid citrate dextrose, ACD. Option C, sodium citrate. Option D, potassium oxalate. The correct answer is option B, acid citrate dextrose, ACD. Yellow ACD tubes contain acid citrate dextrose and are used for HLA typing, DNA studies, and some cellular testing. ACD preserves cells by anticoagulating the specimen while supporting cell viability. SPS yellow tubes are intended for blood cultures and have a different additive. Question 57. Which of the following additives is used to preserve glucose stability by preventing its breakdown by red blood cells? Option A, sodium citrate. Option B, sodium fluoride. Option C, lithium heparin. Option D, ammonium oxalate. The correct answer is option B, sodium fluoride. Sodium fluoride preserves glucose by inhibiting glycolysis in blood cells. This slows cellular consumption of glucose after collection. Citrate, heparin, and oxalate alone do not provide the same glycolysis inhibition. Question 58. Why is the first drop of blood wiped away during a capillary puncture? Option A, it contains skin surface bacteria. Option B, it contains tissue fluid contamination. Option C, it hemolyzes too rapidly to be accurate. Option D, it clots too quickly to be collected. The correct answer is option B, it contains tissue fluid contamination. The first drop from a skin puncture often contains tissue fluid and surface contaminants from the puncture process. Wiping it away improves specimen quality and reduces dilution of the sample. Collecting that first drop can contribute to inaccurate chemistry or hematology results. Question 59. Which of the following elements can cause a falsely elevated calcium level during a venipuncture? Option A. Prolonged tourniquet application past 2 minutes. Option B. Chilling the specimen on an ice slurry. Option C. Using a 21-gauge needle on a large vein. Option D. Failing to wipe away the first drop of blood during a finger stick. The correct answer is option A. Prolonged tourniquet application past 2 minutes. Prolonged tourniquet application can concentrate proteins and protein-bound analytes, including calcium. This may create falsely elevated calcium results. Chilling, normal needle size, or capillary first drop handling do not cause the same venous stasis effect. Question 60. Which of the following additives is present in a light green top plasma separator tube, PSD? Option A. Sodium heparin and a gel barrier. Option B. Lithium heparin and a gel barrier. Option C. DDTA and a gel barrier. Option D. Clot activator and a gel barrier. The correct answer is option B. Lithium heparin and a gel barrier. Light green PSD tubes contain lithium heparin and a gel barrier. Lithium heparin prevents clotting, and the gel separates plasma from cells during centrifugation. SST tubes contain clot activator for serum rather than heparinized plasma. Question 61. What color top tube contains the additive EDTA and is used for molecular diagnostic testing and viral load checks? Option A. Pearl/white top with gel barrier. Option B. Light blue top. Option C. Gray top. Option D. Yellow top with SPS. The correct answer is option A. Pearl/white top with gel barrier. Pearl or white top tubes commonly contain EDTA with a gel barrier for molecular diagnostic tests such as viral load testing. EDTA helps preserve nucleic acid stability and prevents clotting. Light blue, gray, and yellow SPS tubes serve coagulation, glucose, or culture-related purposes. Question 62. Which of the following scenarios describes the correct patient preparation for an oral glucose tolerance test, OGTT? Option A. The patient should eat a low-carbohydrate diet for 3 days prior to the test. Option B. The patient must fast for at least 8 to 12 hours before the baseline draw is performed. Option C. The patient should exercise vigorously right before drinking the glucose solution. Option D. The patient can drink black coffee or tea during the hours of the testing period. The correct answer is option B. The patient must fast for at least 8 to 12 hours before the baseline draw is performed. An OGTT begins with a fasting baseline specimen, usually after 8 to 12 hours without caloric intake. Food, coffee, or strenuous exercise can alter glucose metabolism and invalidate the test. A low-carbohydrate diet before testing can also distort the response to the glucose load. Question 63. If a phlebotomist notices that a patient's name on an ID band matches the requisition, but the medical record numbers are different, what should they do? Option A. Draw the specimen and cross out the number on the tube label. Option B. Proceed with the draw as long as the alphabetical spelling of the name is correct. Option C. Do not collect the specimen until the discrepancy is resolved by admissions or nursing staff. Option D. Ask the patient which number is the correct one to use. The correct answer is option C. Do not collect the specimen until the discrepancy is resolved by admissions or nursing staff. Matching names are not enough when medical record numbers conflict. The specimen must not be collected until the discrepancy is resolved by appropriate staff. Asking the patient to choose a number or editing labels manually can create a serious identification error. Question 64. What clinical term describes the liquid portion of a blood specimen that has been allowed to clot completely before centrifugation? Option A. Plasma. Option B. Serum. Option C. Whole blood. Option D. Buffy coat. The correct answer is option B. Serum. Serum is the liquid portion of blood after the sample has clotted completely and been centrifuged. It lacks fibrinogen because fibrin clot formation has already occurred. Plasma is obtained from anticoagulated blood. Question 65. Which of the following variables can cause a specimen to appear cloudy or milky white after centrifugation? Option A, high levels of lipids, fats, circulating in the blood. Option B, extensive hemolysis from using a small needle. Option C, elevated levels of direct and indirect bilirubin. Option D, failure to mix an anticoagulant tube after drawing. The correct answer is option A, high levels of lipids, fats, circulating in the blood. High circulating lipid content produces a cloudy or milky serum or plasma appearance after centrifugation. This condition is called lipemia and may interfere with optical laboratory methods. Hemolysis creates red discoloration, while icterus creates yellow discoloration. Question 66. What type of transmission occurs when an infectious agent is spread through contaminated food, water, or drugs? Option A, vehicle-borne transmission. Option B, vector-borne transmission. Option C, airborne transmission. Option D, direct contact transmission. The correct answer is option A, vehicle-borne transmission. Vehicle-borne transmission occurs through contaminated food, water, drugs, or other shared substances. The infectious agent is carried by a non-living medium to the host. Vector-borne transmission involves living carriers such as mosquitoes or ticks. Question 67. Which of the following tubes should be collected last in the standard venipuncture order of draw? Option A, light blue top. Option B, lavender top. Option C, grey top. Option D, green top. The correct answer is option C, grey top. Grey tubes are drawn near the end of the standard venipuncture order because fluoride and oxalate additives can interfere with other tests. Earlier tubes such as cultures, citrate, serum, heparin, and EDTA have higher priority in the sequence. Drawing grey tubes too early increases additive carryover risk. Question 68. What is the clinical term for a state of fainting or temporary loss of consciousness caused by a sudden drop in blood pressure? Option A, syncope. Option B, shock. Option C, vertigo. Option D, hemostasis. The correct answer is option A, syncope. Syncope is a temporary loss of consciousness caused by reduced blood flow to the brain, often from a sudden blood pressure drop. It may occur during venipuncture due to anxiety, pain, fasting, or vasovagal response. Shock and vertigo are different clinical conditions. Question 69. Which of the following factors can lead to hemoconcentration during a blood draw? Option A, releasing the tourniquet as soon as blood flow is established. Option B, allowing the patient to pump their fist repeatedly and forcefully. Option C, positioning the patient's arm downward during the procedure. Option D, using a large bore needle on a deep, patent vein. The correct answer is option B, allowing the patient to pump their fist repeatedly and forcefully. Forceful or repeated fist pumping during tourniquet application increases local muscle activity and venous stasis. This can concentrate analytes and falsely elevate potassium or other chemistry values. The patient may make a fist, but continuous pumping should be avoided. Question 70. What type of isolation precautions must be followed when entering a room to draw blood from a patient with an active vancomycin-resistant enterococcus, VRE, infection? Option A, airborne precautions. Option B, droplet precautions. Option C, contact precautions. Option D, protective reverse isolation. The correct answer is option C, contact precautions. VRE is commonly spread by direct contact with contaminated hands, surfaces, or equipment. Contact precautions use gown, gloves, and dedicated equipment to reduce transmission. Airborne and droplet precautions are reserved for respiratory spread. Question 71. Which of the following tests requires a fasting specimen to ensure diagnostic accuracy? Option A, complete blood count, CBC. Option B, lipid panel and fasting blood sugar. Option C, blood culture series. Option D, prothrombin time, patient. The correct answer is option B, lipid panel and fasting blood sugar. Lipid panels and fasting blood sugar tests are strongly affected by recent food intake. Fasting helps standardize triglyceride and glucose measurements for diagnostic interpretation. CBC, blood cultures, and patient usually do not require fasting for accuracy. Question 72. What is the standard depth of a lancet puncture used for a fingerstick on an adult patient? Option of 1.0 to 1.5 millimeters. Option B 1.8 to 2.4 millimeters. Option C 3.0 to 4.0 millimeters. Option D 4.5 to 5.0 millimeters. The correct answer is option B, 1.8 to 2.4 millimeters. Adult fingerstick lancets generally penetrate about 1.8 to 2.4 millimeters. This depth reaches the capillary bed while limiting injury to deeper structures. Shallower punctures may not provide adequate flow, and deeper punctures can cause unnecessary trauma. Question 73. What clinical term describes a systemic infection caused by pathogenic microorganisms or their toxins circulating in the bloodstream? Option A, hematoma. Option B, sclerosis. Option C, septicemia. Option D, petechiae. The correct answer is option C, septicemia. Septicemia is a systemic bloodstream infection caused by pathogenic microorganisms or their toxins. It is clinically serious because organisms and inflammatory mediators circulate throughout the body. Hematoma, sclerosis, and petechiae describe local bleeding or vessel conditions rather than systemic infection. Question 74. What is the correct angle of insertion for a standard multisample needle during a venipuncture? Option A, 5 to 10 degrees. Option B, 15 to 30 degrees. Option C, 45 to 60 degrees. Option D, 90 degrees. The correct answer is option B, 15 to 30 degrees. A standard straight needle is usually inserted at a shallow 15 to 30 degree angle to enter the vein smoothly. This angle helps avoid passing through the vein or striking deeper structures. Very shallow angles can miss the lumen, while steep angles increase tissue trauma. Question 75. What should a phlebotomist do if they accidentally touch the site after it has been cleansed with alcohol? Option A, proceed with the venipuncture immediately before the site gets contaminated further. Option B, blow on the skin surface to dry any skin oils that transferred. Option C, re-cleanse the site completely with a fresh alcohol prep pad and allow it to dry. Option D, wipe the needle tip with alcohol before inserting it into the skin. The correct answer is option C, re-cleanse the site completely with a fresh alcohol prep pad and allow it to dry. Touching a cleaned puncture site recontaminates the skin and compromises antisepsis. The site should be cleansed again with a fresh prep pad and allowed to air dry. Wiping the needle or blowing on the skin does not restore a clean field. Question 76. Which of the following tubes should be collected first when performing a venipuncture draw using a multisample needle? Option A, light blue top, sodium citrate. Option B, blood culture bottles or yellow SPS tube. Option C, red top, serum. Option D, green top, heparin. The correct answer is option B, blood culture bottles or yellow SPS tube. Blood culture bottles or yellow SPS tubes are collected first in a multisample draw. This protects the culture from additive carryover and supports sterile organism recovery. Coagulation and other additive tubes follow in the established order of draw. Question 77. What tube additive prevents clotting by binding or chelating calcium? Option A, lithium heparin. Option B, EDTA. Option C, sodium polyenthol sulfonate. Option D, thrombin. The correct answer is option B, EDTA. EDTA prevents clotting by chelating calcium, a required cofactor in the coagulation cascade. This makes it especially useful for hematology testing where cells must remain unclotted. Heparin inhibits thrombin activity, SPS supports blood culture recovery, and thrombin promotes clotting rather than preventing it. Question 78. What should a phlebotomist do if they encounter an aggressive, uncooperative psychiatric patient accompanied by an order for blood work? Option A, enlist colleagues to restrain the patient by force without nursing guidance. Option B, postpone the draw and consult with the nurse in charge of the patient's care. Option C, attempt to draw blood while the patient is asleep. Option D, cancel the test order permanently on your own authority. The correct answer is option B, postpone the draw and consult with the nurse in charge of the patient's care. An aggressive or uncooperative psychiatric patient requires a safety-focused pause and coordination with nursing staff. The care team can determine whether the draw should be delayed, supported, or handled under a specific behavioral plan. Drawing while the patient sleeps or using force without guidance creates serious safety and legal risks. Question 79. What is the correct order of draw when collecting a blood culture, a chemistry SSD, and a sodium citrate tube using a multisample needle system? Option A, SST, light blue, blood culture. Option B, blood culture, light blue, SST. Option C, light blue, SST, blood culture. Option D, blood culture, SST, light blue. The correct answer is option B, blood culture, light blue, SST. Blood cultures are drawn first, followed by light blue citrate tubes and then serum tubes such as SST. This sequence protects culture sterility and reduces additive carryover into coagulation specimens. Drawing SST before citrate can introduce clot activator or gel-related contamination risk. Question 80. Which of the following tests requires a plain red top tube with no gel or additives? Option A, complete blood count, CBC. Option B, type and screen. Option C, certain therapeutic drug levels that bind to gel barriers. Option D, plasma glucose tracking. The correct answer is option C, certain therapeutic drug levels that bind to gel barriers. Some therapeutic drugs can bind to separated gel or be affected by tube additives. A plain red top tube without gel is used when the test requires serum free from gel interference. CBC, blood bank testing, and plasma glucose monitoring use different specimen types. Question 81. What type of transmission is prevented by wearing an N95 respirator when working with a patient who has active tuberculosis? Option A, droplet transmission. Option B, contact transmission. Option C, airborne transmission. Option D, vector-borne transmission. The correct answer is option C, airborne transmission. Active tuberculosis is spread by airborne droplet nuclei that can remain suspended in the air. An N95 respirator helps filter inhaled particles when entering an airborne isolation setting. Surgical masks are used for droplet precautions, and gowns or gloves address contact risks rather than airborne inhalation. Question 82. What should a phlebotomist do if they encounter a patient who does not speak the same language as the healthcare provider? Option A, use hand gestures to explain the invasive procedure and proceed with the draw. Option B, enlist the services of a certified medical interpreter to ensure proper communication and consent. Option C, ask the patient's roommate to translate the instructions for you. Option D, cancel the test order and document the patient as uncooperative. The correct answer is option B, enlist the services of a certified medical interpreter to ensure proper communication and consent. Certified medical interpreters ensure that the patient receives accurate information and can provide meaningful consent. Family members or untrained staff may omit, alter, or misunderstand medical details. Clear communication is essential for safety, cooperation, and legal compliance. Question 83. Which of the following options defines the proper location for a dermal puncture on an infant's heel? Option A, the posterior curvature of the heel directly over the calcaneus bone. Option B, the medial or lateral margins of the plantar surface of the heel. Option C, the central arch area of the foot pad. Option D, the tips of the smaller toes. The correct answer is option B, the medial or lateral margins of the plantar surface of the heel. Infant heel punctures should be performed on the medial or lateral plantar margins of the heel. These sites reduce the chance of striking the calcaneus and provide suitable capillary blood. The arch, posterior heel, and toes are unsafe for routine newborn heel sticks. Question 84. Which of the following elements is a primary link in the chain of infection? Option A, the source or reservoir of the pathogen. Option B, the cost of personal protective equipment. Option C, the layout of the outpatient laboratory facility. Option D, the brand of antiseptic wipes used to clean benches? The correct answer is option A, the source or reservoir of the pathogen. A reservoir is a primary link in the chain of infection because it is where a pathogen lives and multiplies. Breaking any link, including reservoir, exit route, transmission, entry route, or susceptible host, helps stop spread. Equipment cost or room layout may influence practice but is not a chain link. Question 85. What type of protective equipment must be worn when performing a venipuncture on a patient with droplet precautions? Option A, an N95 respirator mask and shoe covers. Option B, a standard surgical mask and gloves. Option C, a full-body Tyvek suit and goggles. Option D, no personal protective equipment is required. The correct answer is option B, a standard surgical mask and gloves. Droplet precautions require a surgical mask, and gloves are used for venipuncture under standard precautions. The mask protects mucous membranes from large respiratory droplets during close contact. N95 respirators are reserved for airborne precautions. Question 86. What type of patient environment requires protective, reverse, isolation protocols? Option A patient with an active, contagious respiratory flu virus. Option B, a patient with an open, draining MRSA wound infection. Option C, a patient with a severely compromised immune system, such as a recent bone marrow transplant recipient. Option D, a patient with suspected food poisoning or viral gastroenteritis. The correct answer is option C, a patient with a severely compromised immune system, such as a recent bone marrow transplant recipient. Protective or reverse isolation is used for patients with severely weakened immune systems. The goal is to protect the patient from microorganisms carried by staff, visitors, and the environment. Patients with contagious infections generally require standard, contact, droplet, or airborne precautions instead. Question 87. What is the primary purpose of the laboratory's safety data sheets, SDS? Option A, to track the daily attendance and performance records of employees. Option B, to provide detailed information regarding chemical hazards, handling, and first aid measures. Option C, to schedule the preventative maintenance routines for centrifuge machines. Option D, to log the critical panic values reported to physicians. The correct answer is option B, to provide detailed information regarding chemical hazards, handling, and first aid measures. Safety data sheets provide essential information about chemical hazards, safe handling, storage, spill response, and first aid. They support employee safety and emergency response in the laboratory. They do not track attendance, equipment schedules, or critical value reporting. Question 88. What type of safety equipment should be accessed if a hazardous chemical splashes directly onto a phlebotomist's arms and torso? Option A standard eye wash station. Option B, a safety drench shower. Option C, a fire blanket wrap. Option D, an isolation gown station. The correct answer is option B, a safety drench shower. A safety drench shower is used when hazardous chemicals splash over large body areas such as the arms and torso. Immediate flushing helps dilute and remove the chemical to reduce tissue damage. An eye wash station is designed for eye exposure rather than full body contamination. Question 89. Specimen tubes must be labeled at what point during the collection process? Option A, prior to entering the patient's room. Option B, immediately after drawing the blood, before leaving the patient's side. Option C, at the central processing lab desk. Option D, after the specimen has finished centrifuging. The correct answer is option B, immediately after drawing the blood, before leaving the patient's side. Specimens must be labeled immediately after collection while still at the patient's side. This practice prevents mix-ups between patients, rooms, or batches of tubes. Pre-labeling tubes or labeling later at the desk creates a serious wrong patient risk. Question 90. Which of the following conditions describes a vein that feels hard, cord-like, and lacks resiliency? Option A, patent vein. Option B, sclerosed vein. Option C, superficial vein. Option D, tortuous vein. The correct answer is option B, Sclerosed vein. A sclerosed vein feels hard, cord-like, and poorly resilient because of scarring or repeated irritation. Such veins may not accept a needle well and can yield poor flow. A patent vein is open and resilient, while tortuous veins are winding rather than necessarily hardened. Question 91. What does the acronym PASS stand for in relation to fire extinguisher operation? Option A, pull, aim, squeeze, sweep. Option B, push, aim, slice, secure. Option C, pull, activate, squeeze, shake. Option D, press, aim, secure, sweep. The correct answer is option A, pull, aim, squeeze, sweep. PASS stands for pull, aim, squeeze, and sweep. This sequence describes the basic operation of a portable fire extinguisher. Using the wrong sequence can waste time and reduce effectiveness during a small controllable fire. Question 92. What type of consent is required before a phlebotomist can draw blood from a minor child? Option A, implied consent from the child's teacher. Option B, informed or expressed consent from a parent or legally authorized guardian. Option C, no consent is needed as long as a doctor ordered the test. Option D, verbal consent from the minor patient themselves. The correct answer is option B, informed or expressed consent from a parent or legally authorized guardian. A minor generally requires consent from a parent or legally authorized guardian before routine blood collection. The child should still receive age-appropriate explanation and cooperation should be sought when possible. A physician order alone does not eliminate consent requirements. Question 93. Which of the following options defines the proper site for an adult capillary puncture? Option A, the thumb or index finger of the dominant hand. Option B, the lateral or medial plantar surface of the heel. Option C, the palmar surface of the distal segment of the middle or ring finger. Option D, the side of the pinky finger near the cuticle. The correct answer is option C, the palmar surface of the distal segment of the middle or ring finger. Adult capillary puncture is performed on the palmar surface of the distal segment of the middle or ring finger. These sites provide good blood flow and avoid bone, tendons, and heavily used thumb or index finger surfaces. The pinky and areas near the nail bed are more prone to injury or poor flow. Question 94. What is the primary function of erythrocytes, red blood cells, in the human body? Option A, defending the tissues against pathogenic bacterial invasions. Option B, participating in the primary aggregation phase of blood clotting. Option C, transporting oxygen from the lungs out to the body tissues and carbon dioxide back to the lungs. Option D, producing circulating antibody proteins in response to vaccinations. The correct answer is option C, transporting oxygen from the lungs out to the body tissues and carbon dioxide back to the lungs. Erythrocytes transport oxygen from the lungs to tissues and help return carbon dioxide to the lungs. Their hemoglobin content allows efficient gas binding and delivery. White cells defend against infection, and platelets support clot formation. Question 95. Which of the following parameters is evaluated when checking a patient's prothrombin time? Patient. Option A, the functional capacity of platelets to adhere to vessel linings. Option B, the extrinsic pathway of the coagulation cascade and warfarin's therapeutic impact. Option C, the total count of circulating red blood cells per microliter. Option D, the efficiency of the kidney to filter out waste urea molecules. The correct answer is option B, the extrinsic pathway of the coagulation cascade and warfarin's therapeutic impact. Patient evaluates the extrinsic and common coagulation pathways and is commonly reported with INR. It is especially useful for monitoring warfarin therapy. Platelet function, red cell counts, and kidney filtration are assessed with different tests. Question 96. Which of the following values represents a normal fasting blood glucose level for a healthy adult? Option A, 70 to 99 mg/dl. Option B, 140 to 180 mg/dl. Option C, 200 to 250 mg/dl. Option D, 300 to 350 mg/dl. The correct answer is option A, 70 to 99 mg/dl. A normal fasting glucose for a healthy adult is generally about 70 to 99 mg/dl. Values above that range may suggest impaired fasting glucose or diabetes depending on diagnostic criteria and repeat testing. The higher ranges listed would be abnormal and require clinical follow-up. Question 97. What should a phlebotomist do if they note a discrepancy between the patient's verbal name and the name on the pre-printed lab requisition? Option A. Change the requisition manually using a pen to match the verbal statement. Option B. Contact the supervisor or ordering nurse to resolve the issue before drawing blood. Option C. Draw the blood and sort out the labeling discrepancy later in the lab. Option D. Assume the patient knows their own name and print a new label on the spot. The correct answer is option B. Contact the supervisor or ordering nurse to resolve the issue before drawing blood. Any mismatch between the patient's statement and the requisition must be resolved before collection. Proceeding with unresolved identity information can create a wrong patient specimen and unsafe results. The phlebotomist should involve the supervisor, nurse, or ordering provider according to policy. Question 98. What type of legal charge can be filed if a phlebotomist discloses a patient's private medical details to a neighbor? Option A. Assault. Option B. Battery. Option C. Invasion of privacy or breach of confidentiality. Option D. Negligence. The correct answer is option C. Invasion of privacy or breach of confidentiality. Sharing a patient's private medical details with a neighbor is a breach of confidentiality and invasion of privacy. Health information may be disclosed only for authorized treatment, payment, operations, or with proper permission. Assault and battery involve threats or touching rather than privacy violations. Question 99. Which of the following additives works by chelating or binding calcium to inhibit the coagulation cascade? Option A. Lithium heparin. Option B. Ethylenediamine tetracetic acid, EDTA. Option C. Sodium fluoride. Option D. Ammonium oxalate. The correct answer is option B. Ethylenediamine tetracetic acid, EDTA. EDTA chelates calcium, removing a key requirement for activation of the coagulation cascade. This prevents clot formation and preserves whole blood for hematology and selected molecular tests. Heparin prevents clotting through antithrombin rather than calcium chelation. Question 100. Which of the following actions is a violation of proper sharp disposal safety guidelines? Option A. Dropping a needle into the sharps box immediately after withdrawal. Option B. Pushing down on items inside a full sharps container to make extra room. Option C. Disposing of a sharps box when it reaches the indicated full fill line. Option D. Placing the sharps container at eye level near the point of use. The correct answer is option B. Pushing down on items inside a full sharps container to make extra room. Pressing down on a full sharps container can cause puncture injury and aerosol exposure. Sharps containers should be replaced when they reach the marked fill line. They should be located near the point of use and never overfilled or manually compacted.